Good afternoon. Welcome to Health and Human Service Committee, Wednesday, October 15th. It is 1:02 p.m. and we're going to call this meeting to order. We do have a packed agenda today. I got a text message from my mentor from GO who told me to keep it crisp. Remember what I learned on my short term with GO. So we're going to keep it crisp and keep things moving along so we can get through our agenda. We do have somebody for public comment. The rules for speaking under privilege of the floor. I agree to a 3-minute time limit. I agree not to raise my voice. I agree not to use lewd, obscene, profane, slanderous, or libelous language, or speak and act in a manner that would tend to incite a breach of the peace. I agree not to speak about county personnel matters. Personnel matters include comments about the job performance of named county employees other than elected officials. After 3 minutes, I agree to leave the microphone and yield the floor. Transferring time to another person is not permitted. I agree to be courteous and not make comments, gestures, outbursts, or other disruptions while other members of the public or legislators are speaking. I agree that if I cause a disruption and am asked to leave, I will leave the chambers. Chris Phi Jones, did I say that right?
There, is that fun?
No, you gotta come right up here to this microphone.
Thank you, everyone. I'm just going to briefly talk about the new work requirements for Medicaid and SNAP that are coming to our county and potentially speak a little bit more in a future session. So as a result of the big, beautiful bill and some decisions made by federal agencies since the passing of that bill, there are going to be, for the folks in our county on Medicaid and on SNAP, the hurdle to get those benefits and maintain those benefits has just got a lot higher. And that's going to impact us quite considerably. So in front of you on page 1 of the thing that I handed out, there's a list of, if you look on the left, it's qualifying activities, and then there are some exemptions and so on. Please feel free to study that at a time of your convenience. I think it's also really critical to add that the way this will work is there will be such bureaucratic hurdles. Typically, when I just briefly reviewed what happened in Georgia and Arkansas in the first Trump administration when they introduced work requirements, and it'll be a real huge lift for agencies to have the staff to produce all the new systems, and people will drop off. That will, the human and economic cost to the county will be quite considerable. I think there's two things that need to happen urgently in parallel. The first of those is the needs assessment. The needs assessment should include at least trying to get clear on the challenges that people are actually going to face to meet these requirements. We think we know what some of them are, but it would be really good to be really, really sure. Different folks have different needs and so on, different challenges. And to work out exactly what the cost is going to be. And that's a whole huge complex issue we won't get into today. Then I think the other project that needs to run in parallel to that is to look at what we can do to support agencies like DSS to take some of the tremendous workload off their plate and to minimize the number of people who drop off SNAP and Medicaid. On the back of the handout, you will see a range of suggestions. Put those together with Chris Spon, who's here today from Tompkins County Workforce Development. Some of those involve workforce support, but they involve a range of other ideas as well, which I'd be happy to discuss with anyone at any time if they so wished. That's it. Thank you very much.
Thank you. Minutes approval for September 17th. Do I have a mover? Donna, Amanda seconds. Appointments. Oh, told you I was trying to be crisp. All those in favor of moving the minutes, please raise your hand. All right. Advisory board appointments, ID 15384. We have Community Mental Health Services Board Substance Use Subcommittee, Amy Jacket. community member, term expires December 31st, 2025. Do I have a mover? Shauna moves, Amanda seconds. All those in favor? All right. I do not have a chair's report other than rescheduling of the December Health and Human Services Committee meeting in December. We still have to pick a date for that.
So we did a consensus of the committee behind the scenes, and it was determined that December 15th from 1 to 3 was the best option.
All right, so we have a date, December 13th, 1, 2, 3. County Administrators Report.
Thank you very much. Under the item that I have here on the list is advisory board discussion. I will invite Brittany to provide us update in terms of information that she's been able to pull together in the direction that the legislature wants us to move into as we head toward 2026.
Yeah, my understanding with the advisory board was it was just put on so that we could have an open discussion about it. Was my understanding from the last meeting.
Yeah,
Shauna.
I think that was the plan. I know that it's probably been close to a year whenever the concern was brought forward. So I hope we are able to find some resolution and help people that want to be involved.
Yeah, and we're working, so we have meetings set up with HSC. We're bringing, this has to do with SNAP, but I think it could help with the advisory board as well. Bringing local agencies together from numerous agencies across the county to come together, not just for SNAP, but we can talk about advisory board too and what that could look like.
I thought a few months ago, we had kind of had two options to pick from.
No, yes, I believe Katrina provided us information. That was, I believe, my few months in here about what options are available at the time was if the legislatures are looking to set up, the nature of that advisory board you're looking to set up, most of the information we derive, Katrina provided was members of our advisory board as constituted will be based on a recommendation from Commissioner of Social Services. And the thought process was we fill out the position, get a new commissioner in place, and then start having the community engagement to see where we land. My thought process is that conversation is beginning with Brittany coming on board within the last 2-3 months. So it's still fresh in our minds in terms of how we approach it. Sorry, the other thing I welcome is specific direction from the legislature, what you want to see at this point if there are thought process, or we can provide you feedback based on that, those community engagement as to which direction we feel would be ideal to go into to make it more effective and proactive if we decide to create it.
Randy.
Yeah, I think we talked about this quite a bit. I think it was consensus of this committee that we wanted an advisory board of some fashion. I don't know if that needs to go before the entire legislature to create this, but that was my question. What's the process that we would make this happen?
Well, I know there were two different versions, I believe, that Katrina offered. And we knew that we wanted one. And of course, it helped me out because I don't remember exactly, but one was an advisory board that would report to the legislature. And the other one was an advisory board picked by DSS that would report to DSS, correct?
Yes. So based on the information, I apologize if I don't have all the details here. The legislatures can always create an advisory board to advise them on any issues, and that includes social services advisory board. But in line with what the state guidance, social services advisory board has to be created by the commissioner with members selected or appointed by the commissioner. And the guidance from Katrina was which direction the legislature feel you want to go into, because at the end of the day, whatever advisory board is set up cannot override the commissioner discretion on issues. So we just need to be clear with direction that you want to go into in terms of which advisory board will be more responsive to community need and be accountable in terms of how we perceive issues and the key items that we want to address when we have such a body set up.
In my feeling, and please others from the legislature, and Brittany, please add, is that we would want an advisory board that would be working directly with DSS rather than an advisory board that would kind of answer our questions. Or do others have feelings about that? Randy?
I think the reason we got here was because the communication structure with Department of Social Services could improve. I'm not saying it's not good or anything like that. I'm just saying that I felt I was uninformed on many things. And I realize it's complicated, so I understand that. I would like to see the advisory board reporting to the legislature, was my thought on that. How it's structured and who's on it, that could be determined, but and it's not a reflection on Department of Social Service, just that I think that, it's a big budget line. Services are provided directly to our constituents, and we hear directly from our constituents. So I felt that it would be best if it was reported to the legislature.
Others? Amanda?
Yeah, I mean, I think I agree with Randy that was kind of how we got here, and that would work for me. I mean, obviously there has to be some overlap, like the people have to have the board, the advisory board will have to have communication with the department, and, I guess whatever direction we go, like, obviously they'll need to be kind of specific. Like, what are they doing? Like, what is their goal? What are they talking about? We don't want to create a board that kind of doesn't, just gets together and talks about stuff. Like, what will their goal be? And as far as I know, Katrina can correct me, but I think we can create an advisory board and this committee can decide to do that. I'm sure it would be a resolution that would go to the full legislature.
Yeah, I was going to recommend that you do it by resolution, and you can set forth what you're charging that board with, the membership makeup and all that can be included in the resolution. And you can even go as far as to create the bylaws and attach them to the resolution, or just direct for the bylaws to be created within X amount of time.
And maybe, I mean, we just, we're talking about the case board yesterday, and that was sort of a temporary board that was set up for 2 years or something. So we could do that too and just say, let's try this for 2 years, have temporary bylaws, see what this group is actually going to do, and then, obviously get reports from them regularly, but then make a sort of final decision in a couple of years.
Is that what you were thinking, Sean?
Yeah, that makes a lot of sense. I mean, I definitely think that it would be helpful, and I feel like this is kind of a checks and balances of our systems and how they're being delivered. I think that the reporting, it really will be essential for them to come to the legislature and just, at least report in, twice a year, and just serve in that advisory fashion. In the same sense, I think there have to be mutual rules and respect amongst the group. This isn't a moment to come and, complain about personal stuff or whatever. I think there really needs to be substance, whenever we're working with advisory boards and people are spending so much of their time volunteering.
Yeah. Can I say something?
Yeah, sure.
I really like the idea of the advisory board and having clear parameters around it. I think a lot of the issues that we would discuss would probably fall in line with state regulations and rules and things that we would need to discuss surrounding that. And I think it would be important that again, that just parameters are set to how do we talk about those things? How do we handle those things? There are a lot of regulations for DSS, which sometimes is to the detriment of our people in our community. And I think having clients, community members, and agencies at the table to have discussions with all of us is important, so that when we are up against these regulations, we can have discussions about how community partners can come in and help us, because there are things that unfortunately we won't be able to address, and we'll have to be able to speak about that and how we can bring others in to collaborate and help fill those gaps. I think that's a really important piece, and I think the advisory council can help with that, our advisory board. And the other piece of that is I've heard a lot about the communication piece, and that is a priority of mine and a goal of mine to change how we communicate with the public. And I had a meeting recently with Monica to start talking about how DSS communicates with the public and what is put out and how it's shared, so that we can be more transparent and have more communication with the public.
So Katrina or Corsa or both, under that version, who would be responsible for putting together that advisory group? Would that be the legislators, or would that still be the commissioner?
So the resolution that Katrina shared with us, I believe, a couple of months ago, resolution number 189 of 1968, that created advisory board in this county. The resolution basically was in line with section 66 of the Social Services Law, which authorizes the commissioner to create such body, and also the members of that body are appointed by the commissioner, but there was an indication of how those members are selected. So the language in the resolution basically provided guidance on where those members will be selected, but they will be appointed by the commissioner to serve on that advisory board.
Okay. All right. Yes.
I guess I would just suggest, like, since we've talked about this numerous times over the year or whatever, that maybe like a couple legislators who are very invested in this have
Always happens.
have a small group to meet with Brittany or other staff and really talk and iron out the details. And then, say, here's what we want this group to actually do. And then come back and this committee could then tweak that.
Yeah, I think that's fair.
And I volunteer Shauna.
I like that idea too.
I would also request that Maury be involved in that.
Maury?
So just Maury, Tuesdays with Maury's, Monday with Maury's.
Mondays with Maury.
Whatever day you want.
Thanks,
Of
Maury.
course, you're
We'll
gonna
send a communication out and get something moving, then we can start having engagement. I think I agree. It is essential that we identify exactly what we're trying to achieve, so that we make sure if we put any group together, our goals are set and we're really working to achieve those objectives.
All right. You have anything else for your report?
No, that's it. I'm working with DSS in posting the human rights director's human rights position. We should get that posted hopefully by the end of the week.
All right, sounds good. So we will move right along to the Department of Social Services. We have 2 resolutions, and then you can share if there's anything that you want to report out on. Budget adjustment, Department of Social Services, New York Child Care Block Grant, NYS CCBG ID 13602. Do I have a mover? Amanda moves, Shauna seconds. You want to tell us a little bit about this, Britt?
So this is additional funding that we received for this year, so it's budget neutral. The associated cost and what we received additionally from the state will cover the rest of this year. Unknowns for childcare will be for next year. And again, that's due to rising costs with expanded eligibility, the lowered family share, the increased market rates. Internally, we're having conversations about what we can do with childcare to lessen the impact about next year. It's still unknown what allocations we'll receive for next year, but this resolution specifically for the rest of this year covers those costs and it's budget neutral.
Any questions for Brittany? Randy?
Yes, Brittany, so is this somehow calculated based on services we've already provided and the state says, okay, we're gonna reimburse a certain amount, or how do this number? come
So
about?
the state looked at costs across New York State. Numerous districts there were increased cost across all of the state. And New York State allocated additional childcare block grant funding to counties based on a percentage model that they do. And we received that additional funding. We actually got more than we needed, but we don't have, you can't roll it over, but it covers the rest of this year's
Great.
cost.
That's good news.
Just for this year, yes.
Any other questions for Brittany? You ready to vote? All those in favor? And that passes unanimously. Resolution, budget adjustment, Department of Social Services, Food Net Contract ID 13603. Do I have a mover? Shauna moves, Amanda seconds. Brittany?
So there's an additional piece to this. We're not actually going to be requesting more money. We received a grant from the Office of Mental Health that will pass through mental health for FoodNet to provide services for emergency shelter, for individuals at emergency shelter who have either physical or mental health challenges. And one of the ways that we can support them is by providing food and then tracking the number of participants who receive those supports and who receive the meals and food associated with the grant. So that funding covers up to $56,804. So that grant will actually go on top of this resolution, if that makes sense. So it's actually, we'll receive more in grant funding than we're asking for in the resolution. We weren't approved yet for the grant, which is why it wasn't included in the resolution, but now we have the grant. So I can say that there's more money there than we're asking.
Questions?
So are you looking to amend the number here, the 47,500?
Yeah, I think that's like a Thomas question. Hold on.
Thomas?
He is on, yeah.
Hi, so it's more the account number. So the 47,500 is to increase the contract that we have with FoodNet. And it's the account number is going to be different because it'll be coming from an interdepartmental transfer from mental health versus trying to use contingent fund money. Was that, sorry, I may be not looking at the right one.
So this resolution is a budget amendment. Are you looking for a budget transfer?
So I need a budget amendment because we need the spending authority for that, but it's going to be, the amount's going to be offset by the amount of the grant that we're getting from the Office of Mental Health.
Okay, so just to clarify, it's the budget numbers are correct, but the amount is going to change, or the budget numbers need to be amended?
Oh, no, wait. Sorry, I didn't pull up the agenda. Is it 41894 for the revenue?
Yeah, 41894, yes.
Yeah, we're fine then. Because this was an increase to the contract that we have done with FoodNet. The items that we have paid for previously, we can't put under that amount, but we
Okay,
can't increase more than that. But if we end up spending more, then we may come back with
okay,
an additional increase to it.
okay, sure.
Questions for DSS?
We shouldn't, we shouldn't be in line to spend more, so we shouldn't have to come back, but
Yeah, Randy doesn't like that.
don't need to.
All right, all those in favor? All right, is there anything you want to report on him, Brett, while you're up here?
Yeah, so I know you're all aware of we call them ABOD requirements, so the able-bodied adults without dependents. So those changes are coming, and that waiver was set to expire February 28th, 2026. Now it's set to expire November 2nd. We just received this information from the state and OTDA. So what that means for DSS is that we will have to contact 1,294 SNAP recipients to schedule meetings before November 30th to assess their eligibility and impacts due to these ABOD requirements. Now, the expanded population due to the big beautiful bill of SNAP recipients that are required to be assessed for ABOD requirements is an additional 1,700 to that 1,294. But those 1,294 are the immediate ones that we need to have done and scheduled by November 30th. So to put that in perspective, that's a huge workload increase for my staff and my units. That translates out to roughly 70 calls a day. Now we working with our director of eligibility to move staff around to pick up these work requirements, to make sure that individuals who will be affected by this, that letters are sent out, that they're called, that we're making these calls, we're moving staff around so that we can meet this increased need and workload so that we can hopefully prevent anyone from losing their benefits. If possible, I mean, there will people that will not meet the eligibility, these requirements, and we'll be working with local agencies to see how we can collaborate to help meet the needs of the individuals who won't be able to continue receiving benefits.
So long term though, like there's this immediate shuffling of staff to be able to manage this immediate need. But my guess is long term, you're gonna need to increase staffing because there has to be bodies to monitor the workload, right? Because folks are gonna have to do their hours, people are gonna have to keep track of that outside of the folks that are doing the intakes.
Yeah, potentially. I mean, we still have unclear guidance from the state. So what I shared now is the clearest guidance that we have. And my director of eligibility is working closely with all of her supervisors to assess, like, what does this mean for workload and what does it mean long-term for workload? And then I can report back. Unfortunately, the downside is that I don't have that clear information yet and direction from the state of how this is going to pan out.
Yeah, it's unfortunate. This isn't new though. I remember years ago when I first started working at GIAC, we used to get folks that had to do hours and they used to bring the sheets over and we used to have to fill them out. So this was the pause on that is now coming to an end.
Yeah. One way that would be helpful for our department would be collaborating with local agencies for individuals to be able to do these work requirements and make their hours, and we can collaborate with agencies on that.
Any questions, Shauna?
Yeah, I mean, I guess I'm just wondering, and we've had concern, but I think for me personally, like I didn't have the concern until January, and I think right now we're trying to forecast what this is going to look like, and we're getting an indicator very early. Is there any way that as a county, we can look at temporary workers to help make those phone calls? Because I feel like people, once they start caring about their benefits, I mean, word gets out really quickly, especially really horrible news that, people rely on this so much. And so, I mean, I guess my question is there any way to hire the temporary workers just to help with the paperwork, the phone calls, and kind of guide people to be able to get the information in?
So it's not that simple.
I didn't
because
figure
the
it was.
training.
I know,
right?
I know there's a lot of stuff.
The
Yeah.
training that is involved in getting people up to speed on this, it's not the training is very nuanced, and that's what makes it difficult, is that the individuals who are able to do the assessments have to have specific training, and it takes a while. So even bringing in someone temporarily isn't going to help us meet that need in this interim period.
Yeah.
This is really, we need to pull people who have the experience across the agency, who have either moved to another unit that can come over and pull comp time to help us meet some of these needs. Long term, if then it changes into that has now increased to we need more full-time staff, that is something that we'll have to bring back to the ledge and be transparent about and explain what the need is there. You know, the other side of this is that while all of the SNAP changes are also happening, I mean, the cold season's here, and we have HEAP, and we have individual, like, we've lost HEAP funding, and that's something that is going to impact individuals too. And then the Medicaid new requirements that are coming, and it's like all of these things, this perfect storm all together happening at once. And it's really unfortunate. And I think it's just going to require that we have more collaboration than we've ever had, which I think overall might be hard for the county, because I think we are resource rich, and sometimes it's hard to come together. And I think we have to continue pushing for that. I think it's really important, because DSS we can't do this alone. There's going to be a ton of people, a ton of clients, community members that are going to be affected by this. And we're going to need a lot of support in helping our community.
Randy.
Let's make sure I understood what you said. So the state or the federal government came back and said there's 1,194 people that will no longer have access to SNAP. Is that what?
No, so there's 1,294 recipients that their waiver is set to expire, and they need to be reassessed to determine if they are still eligible for benefits. So that 1,294 individuals are the ones that we need to schedule and assess their eligibility again before November 30th. So not all of them will lose the benefits. That's what the assessment will determine. And Adele is on. Adele is the one that should answer these questions. She's the director of eligibility and oversees this, so she can give more of a nuanced answer than I can.
Adele?
Hello.
Hello?
Hello, can you hear me?
Yep.
Hi, everybody. So the one point I wanted to add is everything Brittany said is spot on accurate. Once our staff complete those assessments, there will be folks that will meet exemption criteria. We will support them in getting the documentation that we need to support that exemption, and then that work will be done. They will not need to meet that requirement. The deadline of November 30th is because this actually goes into effect December 1st. That's the first, what OTDA calls accountable month. So this is not good, but it's not as bad as people are going to lose benefits who may not meet the requirement now. They have 3 months of countable months prior to the potential of losing their benefits if they don't meet an exemption or meet the work requirements. So this is still bad. Please don't misunderstand, but it's not going to impact people like in November if we do. So I just wanted to explain that, because as I think Shauna mentioned, when bad information gets out, it spirals and folks hear things that maybe, so we have met with supervisors. We have a follow-up with our OTDA contacts again tomorrow. We are pulling staff, clerical staff, doubling, tripling up folks on what we can do to make this happen, working with our ICT folks for how we need to track things. So we are making the plans that we need to make.
Thank you. Any questions for Adele?
Well, I guess I'm still just trying to understand, and I think you all are explaining it very well. But so if somebody, I'm just thinking of it in terms of a person who needs this reassessment. If they come in, they have their meeting, and you determine that they don't meet the requirements anymore, what do? They have to go find a job for 20 hours a week, or?
No, so the way, I know it's work activity, and work activity can be defined as many different things. Um, so, I mean, I can pull some stuff together to get more specific information because I don't want to mislead anybody. Volunteering can be a work activity, which is where Brittany was leading with us working with community partners for volunteer opportunities and how to document that. Like Travis mentioned, way back when we still had ABOD last time, GAC was a place where folks could do that. So the more we can build up opportunities for folks, the better. There are different ways to meet these work requirements in a combination. When I say work requirements, they're work activities. So it doesn't mean just get a job. There are different ways that it can be met, and it can be a combination of things. So that is one of the things when we do these assessments, we will be explaining to folks. Some folks may already be doing these things, volunteering at their church. And what we need is to explain to them how to document that on a regular monthly basis so we can maintain their benefits. So those are all the things we're working with staff now in the state offerings of trainings to get everyone up to speed with the nuts and bolts of this once we roll it out and are interacting with the public about the impacts on them.
Okay, thank you for explaining that further.
Sean?
I think what will also be really important is to communicate with the people that are receiving services, because I can imagine what happens is one person hears a rumor, or even if it's factual, and then it's just a game of telephone, and we don't want people to be upset with maybe something that's not even the true situation. I think, we have to, even if it's a matter of the legislature saying, we'll put $5,000 towards a marketing budget or communications budget or whatever, because I think right now the best thing is going to be to let people know how they're going to be affected, and then obviously, we don't want you to lose your benefits. Here's what you need to do.
Yeah. And Adele and I are working on communication to give to community and participants. The one thing that we don't want to do is create panic, because not everyone who has SNAP benefits is going to lose their benefits. And it's also hard to say right now, until an assessment's done, we can't say for sure if an individual is going to lose their SNAP benefits. So we don't want to create that undue panic. But we are working on what we can give the public at this time to keep them aware of what's happening, what we're trying to do, and what individuals can also do. So another thing that we're working on, which we discussed last time, is we're working with Cindy and Human Services Coalition to bring agencies together to have a discussion about SNAP and food insecurity and how we can get food to individuals who either need more food or need some support with they're not receiving benefits anymore or not receiving enough.
I know that I've heard you say several times now that building relationships with agencies in the community is one of your priorities, and sometimes through necessity, you on the other end, when you come out of it, sometimes the best relationships are formed. So, but this is definitely problematic in a lot of ways. It may help move things a little faster in that effort to rebuild and connect with other agencies. So
I agree.
let us know what you need.
Will do. Thank you.
Anything else?
There's a full agenda, so I think
All
that's
right.
okay.
We're going to move on to whole health. And we have a few resolutions. I'll start with those. Budget adjustment, multiple budgeting units, whole health department, ID 13581. Do I have a mover? Shauna, Amanda seconds. And the floor is yours.
Yeah, hi, everybody. So it looks like this is an amendment that is OMH pass-through funding that has increased. We don't necessarily, these are programs where we receive money from the state that go to places like Racker, Catholic Charities, Family and Children's. We don't always necessarily know the amounts when we budget, so we use historical figures and then we adjust as those rates from OMH have increased over the year. So this resolution looks at an adjustment of those rates and those programs.
Any questions? Ready to vote? All those in favor? All right, that passes. Authorization to accept funds from the Park Foundation Community Health Whole Health Department, ID 13610. Do I have a mover? Amanda moves, Shauna seconds.
This one we have had the pleasure of chatting about before. This is some additional funding that will be coming as to support to support a program that will create a cohort of Black doulas in Tompkins County. This is through an initiative with the Doula Collective, and they're looking to come together with a group of women to support a program to create a Black doula program to support Black maternal mortality by addressing clinical and structural determinants of health. So this is really exciting, and they're piecemealing some funding together for a really tremendously wonderful program. And when it started, I can't wait to come back and tell you more about it, because I think this is just a great effort and I'm so excited.
That is exciting.
No, go
Amanda?
ahead.
No,
Go
go
ahead.
ahead.
Well, I was just gonna say, yeah, it's really cool. My doula, when I gave birth, was amazing and completely essential to my success. And so seeing this opportunity for women to do this work, but also support other women is really amazing. So thank you.
Is the idea to increase the amount of doulas, or if there's Black doulas that already exist, to bring them in, or both?
I think it's both. I think this is going to be, my understanding is this will it'll be able to train 6 women to become doulas. There is a group of women right now who meet, I believe it's called the Sister Circle. And it's a group of women of color who meet to discuss birth, their birthing story, and sort of through this work, they identified the need to have specifically access and a resource for Black doulas for women of color, here in the county. And so working with a professor, I believe from Ithaca College, as well as a few other community organizations. They've kind of visioned up this program and are bringing it to life.
So it is exciting. My daughter became a doula a few years ago. And so this is really cool. This is exciting.
I also had a doula, and I like to joke that she fed me a granola bar. I had twins, so I held a baby and my partner was holding a baby, and my doula fed me food because we both had our arms full. So I agree too.
That is
It's great.
awesome. Randy?
Maybe because I'm old, I don't know what a doula is, so. if you
Oh,
could-
sure. So a doula is a support figure that can support women or pregnant people through the childbirthing process, including pregnancy. So you meet with your doula several times before you give birth, and then your doula attends typically the birth of your child. And they're there with you in the room, and they're there to be your advocate and kind of an extra person to support you. They're not necessarily, but they could be a trained medical professional, but typically they have more of a community health worker background, but a vast array of deep expertise and subject matter expertise around birthing. So I'm not trying to minimize what they bring to the table by saying that they're not a medical professional, but they play sort of a different role of advocacy and support.
More than a midwife then.
It's different than a midwife. It's kind of a different role that they play. They're there to be a voice for you as their client, whereas the midwife is there to sort of make medical decisions around the birthing process.
Thank you. Amanda?
Yeah, my doula, she was there with me through labor. And when my husband got tired, he would go take a nap and she was there. So it's like an extra person to help the woman. And she went to the hospital. It's just like another support person as you're going through this very intense process. And my labor was very long. And so having her advocate for me, and I wasn't fully there. And so she was advocating for me with the doctors and the hospital and the nurses, and because we had talked earlier about what I wanted and what I didn't want, and she knew all of that. So in the moment, she could help support me versus, just focusing on the medical aspects or, my husband or anything else. So it's really just another support person specifically for the woman.
And they frequently do postpartum visits. So they'll check in after your kiddos are born, they'll visit your home. They can help with a variety of household needs. Maybe it's getting groceries, maybe it's holding your kid while you can go take a nap. So they sort of provide this sort of wraparound support.
Does sound cool. Thanks.
Mm-hmm. You ready to vote? All those in favor? All right, that passes unanimously. Last one, budget adjustment, Rural Health Institute of New York, Whole Health Department, ID 13611. Do I have a mover? Shauna moves. Amanda seconds.
So this one is funding that has come from Oasis. As you may recall, the Rural Health Institute picked up some of the functions of the Alcohol and Drug Council Treatment Program. I forget the full name. And so this was just, there was a change in the budget cycle for the work that Rural Health Institute was doing around substance use prevention. And so this is an adjustment to reflect that they weren't operating for the full year. They sort of started a little bit later in the grant cycle. So it's sort of just a reflection of paying them out for the time that they were doing this work, which is substance use prevention services.
Questions? No? We ready to vote? All those in favor? And that's unanimous. And while you're here, Jenny, would you like to share?
I do have a couple of updates. The first one I wanted to share, and I believe you all should have gotten an email. We're having a ribbon cutting for our mental health clinic at Brown Road. We actually opened our mental health clinic at Brown Road about a year ago, but kind of we're doing a bit of a soft launch, and now we are ready to have a more hard launch, if you will. And so that is November 7th, and we hope that you can join us. There'll be tours of the clinic, some refreshments, et cetera, et cetera. I wanted to note that we are lucky that the federal government has finally released vaccine for our Vaccine for All and Vaccine for Children program. We had been looking at having to purchase that ourselves, particularly the COVID vaccine, to make that available. And so we are grateful that that has been released, and we are now able to order vaccine as we have historically done through this program. A couple of other federal related updates. I sympathize with Brittany, but we are a little lucky on our end that New York State WIC is continuing despite the federal shutdown. That was sort of a state by state choice, and New York State has decided to continue WIC, so that is great. And then I wanted to highlight two community convenings that happened last week. We had one community convening for our CHA CHIP, which is the Community Health Assessment and Community Health Improvement Plan. This is a process that all health departments and hospital systems have to go through every 5 years to kind of establish their priorities for the county for the subsequent period of this program. And we have a wonderful steering committee that has been working on this for nearly 2 years. The planning process is really intensive. It involves several other county departments as well as community partners. And they held a wonderful convening last week. I think there were over 40 folks that kind of came to talk about the priorities and start to identify interventions around one of those. And particularly one that has risen to the top over and over and over again and will be included is nutrition security. So I think that's something I really wanted to highlight for this group, especially in light of our conversation around SNAP benefits. And so we'll be thinking about, from a health lens, what are the pieces and interventions for the next 5 years that we could try to advance around nutrition security. The other community convening that happened was a New York State Office of Mental Health OMH engagement session. I also saw a couple of you there. That was really wonderful. Our staff supported the New York State Office of Mental Health as they were asking community partners and organizations for their feedback on mental health access and services here in Tompkins County. Really rich discussion, and that was really great to hear. And I think, I shared this with my team as well. What I really took away from those discussions were that people feel really good about the services that they receive from the county. There's no discussion about bad quality of services, not having a therapist that you like, or not feeling like you have access to the public health services you need. It's really more about, well, it is about access. How do I get to those things? Transportation, as related to access, and then some collaboration for the community. So I thought that those were the themes that I heard were really, housing, transportation and access, and then how partners and organizations work together. And so I think we really took that back, and I wanted to sort of really also applaud my staff for just hearing from everybody how good they feel about the services when they're able to access and get those services. So we certainly could expand our volume tenfold, I think, and still maybe not to meet the demand. But the services that we are providing, people had really positive things to say about them. And that is it for me.
All right, any questions? Thank you so much. We are going to move over to Office of the Aging with Lisa Monroe. We have 5 resolutions. Budget adjustment, Tompkins County Office for the Aging. Unmet needs budget increase, ID 13623. Do I have a mover? Shauna, Amanda seconds. Lisa,
Hi, everyone. Thank you. Yes, this is just as you said, a budget increase. And our final grant allocation came through, and we are making this budget adjustment increase to support some of our services that we already have, transportation, legal, home repair, and our in-home care services with our agencies and directly provided. So pretty much is that.
Amanda?
This is the revised one we have?
This is not the revised one. That one's the NISIP one. That's the next one, I think.
Okay.
Randy?
Hello, Lisa. So was this,
Hi.
revenue expected or estimated, and this is just the final understanding of it, or is this something that surprised you?
Well, I can say yes to, I think, all three of those questions. Yes, it was budgeted for. We do budget for it every year. It was a more than we budgeted for because we only get tentative allocations and we don't know what we actually get until our final allocations, and this was more. We had heard possibly this was happening, but we thought it was for 2026, possibly not for 2025. So it was a little surprising in that way. I hope I answered your question.
You did, thank you.
Any other questions for Lisa? Everybody ready to vote?
Yep.
All those in favor? That's unanimous. And we'll go to the next one, which is the revised budget adjustment, Tompkins County Office for the Aging Nutrition Services Incentive Program, NSIP budget decrease. Do I have a mover? Amanda, Shauna seconds. Lisa?
Yes, thank you. Again, just putting our final allocations in line with what we actually received. So this is a reduction, and it will be, it's affecting FoodNet as far as that, and I say affecting, it's going to change their budget a little bit, but as you can see, it's going to be made up in the following resolutions.
All right. Questions for Lisa? No? All those in favor? All right, that passes. C, resolution budget adjustment, Tompkins County Office for the Aging, expanded in-home services for the elderly program, EISEP, budget increase 13625. Do I have a mover? Shauna moves, Amanda seconds, and Lisa.
Kind of the same story with all of these. We've got our final allocations, and this is an increase to our ISEP program, which is our in-home care services program. And it's just an increase, and we're adjusting the budget to reflect it.
Any questions for Lisa? Ready to vote? All those in favor? That's unanimous. D, budget adjustment, Tompkins County Office for the Aging, Title 3C, budget increase, ID 13626. Do I have a mover? Amanda moves, Shauna seconds. Lisa.
Okay, same story, sticking with it. And it's this increase will offset some of the decreases that FoodNet receives. Title 3C is really the funding that we attach to our home delivered meals and congregate meal program.
Any questions for Lisa? Ready to vote? All those in favor? That is unanimous. Last one. Resolution budget adjustment, Tompkins County Office for the Aging, Wellness and Nutrition, the WIN program, budget increase 13627. Do I have a mover? Amanda moves. Randy seconds. Lisa.
Great. This is, Wellness and Nutrition Program. This is an increase again to our contract. We'll put it forth to our contract with FoodNet to provide home delivered meals and congregate meals. So it's just an adjustment.
Questions for Lisa? Randy?
Yeah, Lisa, in a budget process, I don't think that the home repair program that Ithaca Neighborhood Housing Services provides passed through the budget. Maybe it didn't make it through something. Is any of this funding gonna replace that?
So I'm not sure what didn't pass through. They do the small home repair program, and I shouldn't call it small home repair because everybody thinks tiny homes, and that's not what it is. The minor home repair program is which they do minor home repair and weatherization repairs is a big program that they do, and they get funding from several sources for that. So our funding that we provide from our office goes to help that program, but there's income limits and there's also age limits attached to that because it comes from us. So we did increase we're going to, now that this is going past, we're going to increase what we've given them because we have a huge waiting list for them. Last time I checked for our clients alone, there was, I think, 45 people on the waiting list. So that's what our funds go for. So I can't really answer if it helps the program overall, but does it supplement what was cut? I'm not sure.
Thank you.
Mm-hmm.
Any other questions for Lisa? Ready to vote? All those in favor? And that is unanimous. Lisa, do you have anything you want to share, report out?
Yeah, a couple things. I wanted to mention that since we were talking about home delivered and congregate meals, we're opening another one of our congregate meal sites with FoodNet at the mall in Lansing on Thursdays. It will be 11 o'clock to 1:30, and it will start next Thursday, the 23rd. So that's another option for people to go have a hot meal. Also today, and part of the reason I'm not here, it's a little busy in the office because it's Medicare open enrollment first day. That we'll be doing our high cap program, health insurance information counseling and assistance program. Our counselors are already busy. That it runs through December 7th, and they are already booked out probably till the end of November. There's a lot of changes and plans in our area. And people are really looking to save money this year. So busy with that. The other thing is I wanted to kind of talk about our age-friendly business initiative that we're launching this week. I was going to show a video, but you guys seem like your agenda is pretty packed, so I'm not going to do that. But we are launching our age-friendly as part of our overall age-friendly work that we do. We've worked with Cornell professor Dr. Janet Lobach and her students for the past probably 4 or 5 semesters we collaborated with them to work on our age-friendly business initiative, which is part of our overall action plan with our age-friendly efforts. And the students helped us design and conduct surveys. They branded materials, created logos. They helped us build a web page and get this ready for this launch this week. Our website is live now with the information on it. And basically, we started to address the population growth, the older population growth in the community, and just understanding and expanding our age-friendly efforts. And this is a great way to engage businesses to understand what that means and to support and understand the needs of older adults and their consumers, and to understand that when you put these principles in place, that it's helpful for everybody that uses these businesses. So we have an audit tool. The video is awesome. You should watch it. It really explains everything I'm trying to say. And it's on our webpage. If you go on our main page, you scroll down about halfway, it says age friendly. There's a tab there. There is, then under that tab, there's age-friendly businesses, and all the information is there, what it's about, what it means. We have all the local businesses that are certified. They receive a certification and a window decal, and they have to go through the whole audit tool and talk about how they're putting these principles in action. And it will be updated even further as more businesses will join on with us, and we'll have a map, working with our GIS team at ITS to create a visual map that people can click on and find out what businesses are age-friendly in the community. Rob and Monica have worked on a nice video that they're going to be putting on the website as well about some of the age-friendly businesses that have already been certified, to kind of highlight them, to attract other businesses to do the same. So just wanted to share that with everybody.
Thank you. Randy?
That sounds pretty neat, Lisa. Could you kind of update us on where you're doing congregate meals now?
Sure. So our main congregate site is still at Titus Towers. We're required by our funding to have a site that's open and available to the public 5 days a week, Monday through Friday. So that's at Titus Towers, so that people can have a meal there. You do have to call ahead and register, so your meal's there when you get there. We also have a congregate site out in Slaterville, at the Slaterville Firehouse on Tuesdays. So people can register to have a meal there. And now Lansing, the mall site, will start next week on Thursdays, and people can register to have a meal there too.
And that's each week?
Yep.
Great, thank you.
Speaking of meals, we are holding our annual Harvest Fest at GIAC in November. We have two options this year. It always was in person until COVID came along. And then we started doing pickups, but this year it'll be a hybrid. So you can come and sit and eat, or you can order a pickup, but that's on the 21st. Lisa, stuff will go out to the Human Service Coalition, but just so you know, on the 21st.
Great. Yeah, we'd like to share that information as well. Thank you.
Yep. All right, thank you.
Bye-bye. Have a good day.
So up next is J.R. Claiborne with Veteran Services.
Pick any seat, it's fine.
Yeah.
Nice. Thank you.
This is the version I about my 5-year debt. But that's so sweet. No, like they like me.
Why are you leaving? Sure, that's your party yet too.
All right, good afternoon, everyone.
Good afternoon.
Oh, man, come on. It's not that late today, is it? Good afternoon, everyone.
Good afternoon.
There we go. I like that. Okay, thank you. And thank you for this opportunity. Again, I'm J.R. Claiborne, Tompkins County Director of Veteran Services. And this August actually celebrated 6 years with the county. So for some of you, that may seem like a short time or may seem like a long time, depending on where you were in this process. But we're here. I think this in my 6 years, aside from my first budget presentation, I think this is my first time to actually give an overview of what we've been doing, what we are doing. So thank you to Chairman Brooks for this opportunity. And I think we're trying to get this scheduled. We said third time's a charm. So third time trying to get this happen. We are here. So one thing I will say to start this off that when I started this, I was hired, I believe you as legislature passed the legislature passed the legislation establishing the department in early 2019. I was hired in end of July of 19. And I learned the true meaning of building a plane while it's in flight, because this was already taken off. So, in this overview, we're going to talk about basically, aside from building the plane, how we built the plane in flight, and we're going to look at how we manage this by talking about our status or where we are, achieving our mission, how we got here, and charging forward, our trajectory.
Gina, could you introduce? Oh, is that on the list? Okay, great.
That's in here, but thank you. So just to start this out, I think kind of replay for some of you maybe from the budget, but I do like to start with reminding folks, just language. Language is a common thing. We all know what the same words mean at the same time, other than conversations where everyone's talking the same thing and hearing different things. So to start this out, we are the Department of Veteran Services, and a veteran, as you see here, is someone who at some point or another wrote a check made payable to the United States of America for an amount up to and including the value of his or her own life. And so that's just something to think about when you see people who are veterans, those who have, whether they're reservists, whether they're active duty. A lot of times when we raise our hand coming out of high school, you're not thinking about that. You're thinking about either going to school, getting out of town, providing for family or other things, but that is ultimately what you are doing when you sign on. Additionally, the VA adds on to this that this has to be someone who served during active duty to be a veteran under the VA federal definition. And basically that means someone who served on active duty, and that includes reservists who served only if they served under presidential order or Title 10 activation, which is different than when the governor calls them up. So if a governor calls a reservist up, that does not count for the time for a veteran, for veteran status as far as the VA is concerned. So we run into that from time to time. And also the VA adds on here that it must be, the veteran must have been discharged under circumstances other than dishonorable. And what that means for us, though, is that we don't put those parameters on people. We serve our veteran population as best we can. So regardless of what their discharge status was, regardless of their service status, we do our best to help them as best way we can. Obviously, there's some things that they may not be eligible for, but we try to figure out where we can plug things in for them. And the last part on here is about Simply Ask, what we have learned. And Reverend Viviana DeCohen, the commissioner, New York State Commissioner of the Department of Veteran Services, she always points out the importance of not asking about veterans. She says when you ask, she said she did a presentation once and she asked for all the veterans in the audience to raise their hands and said a few hands went up. And she talked some more and came back to it and said, okay, how many people in this audience have served our military? And the majority of the hands went up. And what that does is that speaks to the fact that, and I was one of them, a lot of people, when you say veteran, you're thinking combat veteran, someone who was actually deployed in the war front. And that's only who a veteran is. And that is not true. It's someone, as we say, if you served in the military, you are, in our eyes, you are a veteran. So our status, make sure I got that right. Our status, so our mission, where we are. We're connecting veterans, local veterans of the armed forces and their families with eligible federal, state, and local resources. Our standard operation procedure is having staff deploy a combination of counseling, referral, direct assistance to connect the veterans and their family to eligible services. And these are just a few of the highlights and things that we do both on those three levels. And we do this by the three of us. I'm coming to that part. Drama. The three of us who are serving a population of estimated above 3,500. Our population that 3,500 does not include our other members of our military connected community, such as active military, such as those at the ROTC, who are the administrators there. It does not include all reservists and does not include their families. So when we say 3,500 plus, there's a heavy emphasis on the plus. So highlights from this is a very top level overview of our department, of our history. But in 2019, the legislature established legislation to establish the Veteran Service Agency. That year, as I said, myself as a U.S. Navy Reserve veteran was hired as the founding director. The Tompkins County Department of Veteran Services opened up as a single employee, single office department housed within the county's Office for the Aging, or COFA. And day one was clientele and training commenced. And when I say day one, really mean that after orientation, I think it was here in the morning for orientation, that afternoon went to COFA, got introduced to staff, got the keys in my hand to open the door, and there was a line of 3 people behind me who were all veterans, and there was a stack of messages that the reception actually was there to give me when I got in. And I remember Karen Bullis, the deputy director, said, "Can he get in the office first?" So the need was there. 2020, I achieved the first of 2 of 3 accreditations needed to be able to carry out the work of the office, primarily with serving and processing claims for our veterans community. Outreach was firmly underway and built a strong network of collaborative partners. Also in that year, the memorial celebrations was assigned to my department. And that department, the memorial celebrations is what we use to buy the flags for the Memorial Day distribution. And a lot of our veterans organizations do a distribution to volunteers around the county to make sure they're putting flags on all of the graves for veterans around the county. And 2023, our first staff expansion. I'd like to introduce Michelle.
Hello. My name is Michelle, and I'm a U.S. Army veteran, and I've been working with JR for a little over 2 years, give or take, a month or 2. Thank you.
And Michelle's big significance here is our first information aid, and you totally underestimate the importance of someone else to be able to even answer a phone call. That was just amazing when she got there, but there are other things of support that Michelle's been able to do, and there are some things that she takes on. She's one of the people that if you call to get your documents, your military documents, primarily your 214, Michelle is someone who can help you directly. She also helps run our Tompkins County Women Veterans Group, which has been going about 2 years now, and it's been going really strong. So Michelle is a key component for making that happen. Also in 2023, we received the Joseph P. Dwyer Support Grant. This is our first time, which opened up new options to support our veterans community. And that was, it started out as a $100,000 grant that's given to, it's different amounts for different counties, but we're in the class that receives 100,000. And that allowed me to do a lot of things that, for our veterans community, and particularly it helps us with things that it's pretty unrestricted, as long as it has to do with helping the support of the veteran. Which in particular when it comes to food, because we know our county policy with our own budget doesn't allow that. So this helps me do that. And it's amazing the people that can come to the table when you offer free food. 2020, okay, a little too far there. 2024, Davi Mosey, also a U.S. Army veteran, welcomed aboard as a temporary part-time project assistant. And that was done through the support grant. And she was able to help us do a lot of heavy lifting. We got some events happening with the department. And then in 2025, to my left here.
Good afternoon. My name is Ignacio Lopez. I'm a Marine Corps veteran, and I'm the newest hire for VSO for Tompkins County. I started May 27th, and you know, this is good work worth doing. And you couldn't ask for a better team than Michelle and JR, and I'm excited to continue the good work that is being done here.
And Ignacio, or Iggy as he's called to his friends, is someone who's jumped in head first, I should say. And it's really helped us get a lot of things going. He's got a lot of irons in the fire, and as months roll out, we'll be able to see some things that are happening. Additionally, that is directly because of Iggy being here.
And him being a Marine. You're not going to say that, are you?
All I say is somebody had to help him get there. So without, you couldn't have the Marines without the Navy.
Department of the Navy.
There we go. We're all in the same family.
Right.
So in achieving our mission, this basically is a highlight of the main aspects of our duties that we do. Compensation is what most people know Veteran Service Agency to do, which is helping veterans figure out how we can get them service connected for different injuries or health conditions that were developed either due to their service, either happening in service or something resulting long-term because of their service. Pension is something that is, it's a financial boon, but not by much, for veterans who served during a time of war. They didn't have to serve in war, they just had to serve during a time of war. Appeals is what we do when a veteran's appeal is denied. I'm sorry, a veteran's claim is denied. A lot of times that can be helping them through it. Maybe there was some paperwork missing. Maybe the VA just simply made a wrong decision. Or it could be that this is something that we're going into newer territory and the appeal can run anywhere from having a hearing with a divisional regional officer who is out of Buffalo, or in some cases, we may actually have to appear before a judge in DC, Washington, DC, for the Veterans Benefit, all right, the Board of Veterans Appeals. Healthcare and enrollment and referral. A lot of times we're telling people about the VA clinic that we have here. And for those that aren't, if they're eligible, we can go ahead and do enrollments for them and help process that. Memorial items, we also handle the paperwork and the claims for burial items such as grave markers that the VA provides for families, for our veterans, as well as things like a presidential certificate and I'm sorry, I'm missing one thing. Oh, telling people about our newest New York State, which formerly known as Sampson. And this body did a resolution in support of changing Sampson into the New York State Finger Lakes Veterans Cemetery. So 20 minutes up the road, it's a beautiful place, and it's something that is offered as a free burial place for our veterans community. And it's for the veteran and their spouse. Recognition things that we do, they include the holiday proclamations that you pass. There's about four a year that I send your way, as well as special events that we help coordinate. And then we also, with Connecting Community, our main communication vehicle is our listserv that we send out, try to not inundate anyone's inbox, but try to send out pertinent information, whether it's veteran specific or community specific that we send out. And also, as I mentioned earlier, our Women Veterans Group really found that that's been a key component of our community, that a lot of our women veterans are still not being recognized. And a lot of them also are still learning that it's okay to be recognized. I remember one of our groups, they talked about calling the VA for service and being told like, okay, can you put your husband on the phone? Like, no, I am the veteran. So that's something that we want to stay on top of.
I think Randy has a question.
Yeah, while you're on this page, and it says for pension for veterans who served during a time of war, who determines that definition? For example, Vietnam was a war, but I mean, Korea was a war, but have there been any wars since then?
Yes.
Okay.
So Congress actually sets those dates. And so actually for Vietnam, they've changed the date since I started. I believe it was listed as 1963, I believe, to 75, and they've moved it backward to 55 to cover some involvement of certain parties of the military who were on the ground. Right now, it's considered since September 11 that we've been in a constant state of war. So basically, any veteran who was discharged today is still considered a wartime veteran.
Thanks.
Okay. Continuing to achieve our mission, we have a number of activities that we support and just try to break it down here monthly. Break it down here by a regular basis. So twice monthly, we host our Warrior Riders Tompkins, which that's the picture of there. This is a group that actually I inherited from Jim Murphy. I don't know if many of you know him, but he was like our veterans advocate, that there's anybody who talked for, worked for, did something for veterans, it was Jim Murphy. And he brought this group over and said, hey, would you like to host us? And I'm like, come on through. And so they've been with us probably since, I think maybe about 3 to 6 months into this that they've been with us. Monthly, we have, oh, I'm sorry, since I have it highlighted, we have a United States Marine Corps female veteran who served during the Vietnam era, which I say that because there's not too many people that you say that. I'm sorry, left out the key part. She's also African-American. First time I met her, my jaw dropped. I'd never heard that combination of anyone being introduced. But Miss Sandra is starting a crochet group for our veterans and people who just want to get to know. So the group right now is 3 veterans and the other 3 have veterans in their families. The Southern Finger Lakes Veterans Connection is a group of 8 county veteran service agencies, including us. I host this meeting each month, and basically it's for us to get together. We're kind of like our own support group. We check in with each other. We trade tips and tricks and find out what are emerging things that we're all dealing with. Women Veterans Group we just started with. The VA's Veterans Advisory Council. This is a body hosted by the VA Clinic. We host the meetings in-house, and it's something that meets bi-monthly, and it's somewhere that allows veterans to come and speak directly to interactions with the VA Clinic, as well as help them figure out ideas for outreach and other related activities. At our annual events, the Veterans Coffee House, I'll just draw attention to that because that's part of our Veterans Week activities that we'll be talking a little bit more about at the end here, but this has been a 3-year collaboration now with McGraw House, so that's been cool to have that. Veterans Era Vietnam Recognition, this is something Davi Mosey I mentioned earlier, surely helped us launch this, and that's an event that coincides with the annual Vietnam Veterans Recognition Awareness Day that's held observed March 29th each year. Our annual Tompkins County Veteran Resources Fair is also part of our Veterans Week activities. We do this in collaboration with New York State Senator Webb's office as well as the VA Clinic. And this year, we're going to be expanding that into an expo. So really trying to capitalize on this 250th anniversary. I mentioned earlier about the memorial celebrations, but that's where we're responsible for procuring the flags for that distribution. And lastly, our Welcome Back to Campus event. We do this yearly with Team RWB. Done this 3 years in a row now. This year, we actually got to take advantage of the fact that Cornell Undergraduate Veterans Association, also known as CUVA, this was their 10-year anniversary. So we changed our Back to Campus event from the cookout that we normally do to actually a cruise. And so Iggy was very instrumental in making that happen. We had about, 42 veterans and their families who came out. It was really cool. Got to cruise around the lake at sunset time. It was a very beautiful time. And of course, as you know, you're talking earlier about collaborations and partnerships. None of this could be done without the multiple collaborations that I've tried to find over the years since I started. Because as you know, you can do nothing by yourself, even if we think we can. And so this is a list of just some of those collaborations that we've had. One in particular that I do want to point out here is Gadabout and Disabled American Veterans. What they have done is they provide transportation. The DAV provides transportation from Tompkins County to Syracuse for medical appointments at the VA hospital in Syracuse. Gadabout actually handles transportation for the DAV locally for veterans. So a veteran who can be established there can basically get free transportation through Gadabout. And I mention them here because in the last 6 months, I'll say conservatively, they've asked us and we've accepted to take on the responsibility of certifying veterans who come through because this helps make connections a little better and quicker for them. Oops. Okay. Sensitive. I just want to point out here that the impact of all of these collaborations and partnerships, and again, this is not all of them, but it's the key ones here, but it's good relations and good results equal more demand for service. So we don't necessarily get a pat on the back, we just get asked for more to do more. And that's something that we gladly do. And just kind of going back to Randy's question earlier, we serve veterans. So right now, presently, probably Korea War. There are still some World War II veterans around, but Korea War is probably more all the way up through the global war on terror and beyond. So this agency is here, this department is here to serve and to continue serving. This is just a snapshot of resources that are offered by the county, by Tompkins County, through assessment, the clerk's office, human resources, and Workforce New York. Particularly the assessment is one that a lot of people like when they know about it because this allows veterans who either served during a time of war, served in the combat field, and who served during, who are service connected for an injury. And in some communities here, not all of them, some veterans who served during the Cold War are also acknowledged, recognized for tax abatement. And our county clerk, this is one of the people I refer our veterans to the most. They are a keeper of record, so veterans who have their DD 214s, I always encourage them to have it put on file with the clerk's office. One of the lessons we learned from COVID is that the value of your 214, your DD 214, you can't get VA benefits, you can't, in some cases we learned you can't retire. If you're trying to get veterans credits for your retirement, you can't get a loan through the VA or you can't get VA healthcare without having your 214. So it's very important to have it in a secure place that you can always get to it. And courtesy of our clerk's office, as long as a veteran has it put on, the original put on file there, all they have to do is they can call up and say, can I get a copy, please? And they'll send a certified copy of their DD 214. So that's a big value that our clerk's office offers. And they also run our return to favor program, which that does is once you put your 214 on file with them, they take your picture and they create an ID for you. So they have our veterans did have a government issued ID that whenever someone asks them about their veteran status, they can just pull out this card that comes from our clerk's office. Continuing achieving the mission, these are just a snapshot of the different levels of benefits that we help people process. Two things I do want to point out here in the New York State is that we, there we go. Yes, that we also do Fresh Connect checks. And that's similar to the Office for the Aging's farmers markets coupons. But these are something that are given out in season. So usually spring to summer. We ran out midsummer this year because they go like hotcakes. But it allows veterans to take those and use it's like $50 worth of coupons. So take that and use that as cash at any farmer's market around the state. And Onward Ops, I always like pointing attention to that, is that this is, I consider it big brothers, big sisters for the military. And Onward Ops is basically a program that anyone can sign up to help or be in support of our veterans community. And it's for newly active members who are within a year of their discharge to a year post-discharge. And it's a program that's designed to help basically give them a soft landing, help their transition into community, and with the ultimate goal of helping reduce the 22 a day, which I believe last was revised to 18 suicides a day in our veterans community that we lose each year. So this is one of the things to help do that. I also want to point out with New York State, if those of you who have been to the airport, there's a big thing in front of TSA that has pictures that just like a slideshow that goes. That is a kiosk that's issued by the Department of Veteran Services. We are the second one in the state that was issued. So that's pretty cool that we're able to say that. And you probably, if you have seen it, you've seen it when it's dark. You've also, hopefully you've seen it when it's light. And what it is we just had various technical issues, but due to the diligence of both the IT department with the state, as well as Tyrone Fish, who was our terminal services coordinator, we figured out the problem and it has been running strong ever since. So every time I go up there, it's just great to see it there. Okay. So at a glance, again, this is something I thought was good to bring over from our budget presentation, but this is just a percentage snapshot of our budget. In particular, I mentioned about the Dwyer grant. That is something that has been very pivotal in the services that we deliver, and it is definitely a true demonstration of leveraging resources, our county resources, to do more. And while by law we cannot bill for our services, we do help generate revenue that comes into our county, and that looks like this. This is kind of a screenshot with information from the VA, but this is both Tompkins County as well as our surrounding counties. I named it here Cuba Lake Region, but it really shows you just the impact of the work that our office does, as well as our veterans community. A lot of people are doing some of the work themselves. There are veterans who may go to our nearby counties because they just live closer to that line. There's some that live in other counties that come to us sometimes. So we all help each other in that way and try and help get our service connection or otherwise bring benefits here. And so that's what that looks like. And then charging forward. So this is what we see as our trajectory. Some of this is things that are right on the horizon. Other is kind of blue sky. I'll just call that horizon too, because I think everything is possible. But in particular, when I first met Corsa, I told him that I'm going to ask you for a new staff person, but like I know not this year, but next year or two in the future. And he's like, wait a minute, I just got here. So I'm just putting it back out there again. I want to see if we can get another person, at least one.
I'm still new.
You're not new anymore.
Yeah,
Cross
you can stop
fingers.
that.
Yes, he's still in his honeymoon period, so.
2 years later.
Yeah. The Veterans Closet is actually something that we're working with one of our Gold Star mothers for. And hopefully that's going to be something that we can get launched here in the next couple of months. Veterans Fund is an idea of something that we want to do sometime going in the near future, basically to try and help basically little things when there's something like out of petty cash, somebody comes in for an appointment, like sometimes it's like they're scrambling, trying to figure out $2-3 because they can't figure out the pay station. And it'd just be nice if we could just be like, we got it, don't worry about it. And other things like that up to a certain point. And then the headquarters modifications, basically right now, because of the way we're constructed, we can only serve one family or one veteran at a time when we're actually dealing with personal information. So we'd really like to get it to where we can actually have all three of us able to operate at the same time. A departmental vehicle. Travis, you asked me about this at the budget. And I noticed that Terry Carroll had mentioned this during one of your budget hearings. And to add to what he mentioned, yes, I have requested one probably for about 3 years. Each year, there's a different reason for why there's a no. Last year I had to take diplomatically because I actually had the money, but there were other considerations, including how do we pay for this going forward. So I'm going to keep this on my list. One of the things in talking with Corsa was trying to figure out what are some different potential opportunities or avenues that we can look at. So I'm definitely embracing that opportunity with him, and we'll be having more conversations. Travel opportunities is not for us. We're not going to Tahiti or anything, but for our veterans community.
JR, is the funding that you had before, I think it was from Dwyer, correct?
Yes,
Is it possible to get that funding again toward a vehicle?
that's what I'm looking into.
Okay.
I don't want to say more than that and jinx it, but that's what I'm looking into. And it may be something that I might have to ask for leverage funds with both matching the county and Dwyer funds, but I'm looking into that and hopefully I'll have a better answer here soon. Travel opportunities, like I said, is just being an opportunity to be able to take our veterans to different things around the state or elsewhere. One of the things with Dwyer is that we can spend money in support of the veteran as long as it's within the state. So the exception to that I know of is the honor flights. So hopefully that'll be something that we can get folks lined up for as well. And this is a typo, but maybe it was a unintended typo. Unrestricted grant funding. But I like the idea of grand. So something we can do that again helps us help better support our veterans community. And then of course, being an increased collaboration to help. There are different legislation on various levels of government. So anything that we can do to help pass that and add more benefits for our veterans community. All right. Thank you.
Thank you.
Had a
Thank you.
bit to talk about here, so I really appreciate this opportunity. And I definitely want to say thank you again for your support and bringing these two folks on board because they have really helped take what I had started out with and really just help us propel forward in big ways.
That's awesome. Amanda.
Yeah, well, thank you for your service in the military, but thank you for this service. You're doing more service for our community, which is very admirable. So thank you. This is all great information. Good to have a really in-depth look. I guess I'm just wondering, I'm sure there's a lot of veterans who come to you and say, can you help me with this, that, or the other thing? How do you reach people who are hard to reach, who may not, call you up and ask for help? I mean, do you have outreach ways, things that you do to try to get to maybe harder to reach folks?
Yes, the best opportunity we have is that our veterans community has its own grapevine, and word travels fast, good or bad. And I've learned that as long as we can put the information out, so via the listservs, via our different partners, letting people know what it is that we do. We have the opportunities. Last month, we were at Airport Day. And so we had to put the information out for people. The month before that, we're at Borg Warner when they had their first, I think it was their first family day since COVID. So we take advantage of opportunities when we can do that. This year and going forward, there will be more of an emphasis on that, because prior to that, I had to pick and choose what I did because people would come to the office, and if I'm out of the office at a meeting or at an outreach event, then that could be a complaint. But then I start staying in the office, which then means I can't do outreach as much. So now that there's more of us on board, we're going to look into different ways that we can help do that. But the biggest thing is really just being able to make sure that our veterans community knows about us, because they will tell others. And there are a lot of people who are supporters of family members who will also call us. They'll hear from someone and they'll call us and tell us about someone who's way back somewhere and try to bring them in as well.
Okay, thanks.
Any other questions for Jeff? I'm glad you were finally able to come and share the report. There's a lot of great information I think is important for people to really understand that this didn't exist several years ago. You stood it up, and now there's a staff of 3, and you all are doing some amazing work and taking care of a group of folks in our community that need to be taken care of. They need the services. They are owed those services, and thank you for doing the work.
Thank you. And one thing I'll just make note of when you say that, Mama V had said this when, Reverend DeCohen, she goes by Mama V, she doesn't want to call her that, but she talked about the fact that we served means that that's in us, that's who we are. And when you look around, a lot of people who are in different places in community service or positions of authority are also veterans. So it's like, once you give, you keep serving your communities.
I definitely can understand that. We have one more, Cindy from HSC had to leave early. So that leaves Kate from the Youth Bureau.
Good afternoon. There's just 3 things that I wanted to bring to your attention. I mentioned the last time I was here that we were short. We have a vacant position in our staffing, the youth service specialist. We have posted that. We did a rework of the job description, and we have received 7 to 8 applications for that are really qualified. And I'm really excited and hopeful that in the next month, we'll be able to onboard somebody that's going to be a great addition to our capacities department. So fingers crossed. I think the job market is shifting a little bit, hopefully. The other thing that I wanted to bring to your attention, in 2022, the Urban Institute published a report funded by the Annie Casey Foundation. They do a lot of work in youth and youth development, and they are leaders in that industry, but it was a review of the domains of well-being for young people. This is a report that the Office of Family and Children's Services has sort of latched onto, and I've been invited to participate in a group. You've heard me use the term positive youth development. The current framework that we use has been in existence for about 10 years. And so as there's been a pandemic and some other things that have happened impacted our youth. And so excited to know that OCFS is looking at that and updating it. One of the major check boxes for our department this year was to look at our Achieving Youth results and update that to make sure that we were doing our next round of funding, which is coming out next spring for 3 years, that would be informed by a new framework for us in Tompkins County. I'm excited that that's being picked up by the state as well. We are really, really close to having that document completed. So that will pull from the 6 touchstones, positive youth development framework, our Achieving Youth results, and also our equity indicators. So we are planning in the fall and into early spring to be bringing this to our funded agencies and to our municipal youth services and just to the community at large and getting feedback. And so that's really exciting. So we're almost ready. It's taken a little bit longer than I had wanted, but we are almost there. The other thing I wanted to bring to your attention, speaking of our funding cycles, we do our funding cycles in 3 years, renewable at the end of each year, with the ability to extend that 1 to 2 years, depending on what's happening in the department. Given the fact that we've been a little short-staffed and we have been doing a lot of work on this framework, we extended out our contracts for a 4th year. And we were notified the early October that Office of Family and Children Services is no longer going to be operating our Open Doors program at the end of this year. They're going to be focusing on their OMH and their mental health services. And so there are several community adjacent programs that they are running that they're going to be not running. And so what this means is that if you look at a four-year contract, they are stopping at the end of year 3. So we have a year where we are looking and we're working with county administration and local providers to try to create an emergency stopgap. This program is really utilized by a lot of our local youth serving agencies, our law enforcement. If there's a youth at risk of being homeless or experiencing homelessness, this is the referral that they're making. And so from DSS to probation, schools, it's really a big component of our RHY, which is fairly limited for youth, but our RHY response, runaway and homeless youth response in the county. And so we're working with county administration and trying to determine the best fit for the next year for someone who is already certified through OCFS that has some RHY experience and would be able to take this program over and to operate it for a year under the emergency sort of stopgap contract. The other piece of this is that we also have our host homes, which are that's designed for respite placement. We currently have 2. That is sort of the second part of the program and does require a certification process for a family to go through. And then we did, through the additional funding that you gave us the last round, we were able to give a sort of a cash incentive to those families to help offset the costs that they take on as they bring a youth in. So we will be working with OCFS with our intention is to make sure that we do not have a disruption in services or that we can minimize that as much as possible. There has not really been a public announcement about that. There was a podcast that came out from Family and Children's. It was kind of in the back half of it, released a couple of weeks ago. So if you hear, talks about that, we are aware of it. We're working with Family and Children's and talking to some other providers to see what we can do with the understanding that whatever we do in 2026, when we release our new RFP for 3 years, which will happen in the spring of next year, whoever has that stopgap contract will have to reapply. So we're just trying to minimize the impact because these youth are marginalized and impacted enough. So that's the most important thing to bring to your attention, and we're working on it. So hopefully I'll be able to bring a new staff member and that new framework to you at the beginning of the year when I do my department report. But that's what I have for now.
Any questions for Kate? All right. Is there any committee members? Do you all have anything to share? Randy?
Sorry about that. I wanted to share a story about a young person, 21 years old, who is fairly new to the area. I met him through somebody else, and his mother lives elsewhere. And he got in a small car accident and it triggered something, and he ended up in Cuba Medical, in the psych ward. I don't know if that's what you call it or not. And his mother contacted DSS and other people and ended up being up there for, I think, 10 to 14 days, quite a while. He had had a job, which he lost because of this episode. But she said that both DSS and the Friendship Center have been fantastic. So I just wanted to share that information that they've been communicated really well. And I just wanted to let you know that because she's out of the area, she feels like she's helpless. And this individual is being taken care of now in housing, I think, fairly shortly, and hopefully can get back into work. So I just want to share that.
Thank you. I do want to share real quick before I came to the meeting today. I was at a press conference at GIAC. Carl Hastings, who is our Speaker of the House for New York State, came into town with Anna Kellis and announced that GIAC was going to receive, for those of you who don't know, Greater Ithaca Activity Center, a $13 million grant to redo our pool. And we're extremely excited. The pool has been in great need of repair and expansion for many years now. So our folks downtown, our community of color, will really benefit from this. So it's very exciting news to be taken care of like that from the state.
Yeah, awesome.
And we are adjourned.
All right. Thanks, Travis.